Thanks, everybody. I actually have to do double duty today because I have to pinch hit for Marco in a minute. But let's do the moderator side first. So let me just say I'm totally honored to be sitting next to Wilma and Nate, Wilma Chen, Nate Miley, two of our local supervisors. But I always have to say when we work with folks like Wilma and Nate, we are so blessed to have such progressive, committed political leaders in our community, and Wilma and Nate, yes. So you can read their bios, but I'm looking forward to hearing from them in just a minute. And then we have Randy Morris over there. Randy is one of our most solid county administrators in the social service agency and agency directors, and I've worked with Randy for a long time, and I can tell you he is committed to aging and committed to getting the best possible services out. And then finally, to my right and your left is Michelle Burke, who is now a public health nurse supervisor in Alameda County, but is a former colleague of mine at Lifelong, I'm happy to say. And Michelle is going to talk about some of the healthy aging activities in a few minutes. So we'll get to that. I think the framing for the panel is simply this. You've heard about these local city, fantastic city efforts really that we just heard about. And now we're trying to think a little bit about what the state and the county's role is in creating a community that we all want to age in and that's friendly to that and healthy to that. I would also say that it was a pleasure to listen to Louise Aronson earlier this morning, and a couple of things. Years ago when I started at Over 60, Lillian Rabinowitz, who was one of our founders and brought the Great Panthers to the area, talked about the need to change geriatric education in order for folks to really get the kind of care they need. And it's great to have Louise. It's not great to have Louise say, hey, we've only made a small amount of progress, but it's great to have her articulate how we need to change the health and mental health and behavioral health workforce of the future to make sure that we are able to get appropriate care. And then finally, my last, and then we'll go to the state plan. My last comment is also, we heard a lot about climate change and environmental factors. Again, not something when many of us entered aging, health, social service work that many of us thought about, but now we understand that climate issues are probably the biggest threat to low-income communities' health that we face, not just in our country, but in our world. And in fact, a number of and of course, as people pointed out, aging and disabled populations are some of the most vulnerable to those effects, whether they be pollution or fire or toxics or water, whatever they may be. But how we respond to those is going to be a lot at the level of state and local policy as well as federal policy. Now, federal policy we're a little not hopeful on right at the moment, but we're very hopeful on state and local policy. So, okay, I'm going to switch roles for a second and just do a few minutes on the master plan, the state master plan, and I'm going to stand up to do that, and then we'll get back and hear from the rest of our panel. Okay, first thing to say is we have help in the audience. Debbie, where are you? Debbie Toth, who is our Contra Costa colleague, but cares enough about the whole issue to be here today, as one of my fellow Stakeholder Advisory Committee members. And I'll also say, so give Debbie a hand, actually. She deserves a hand, yeah. Debbie, help me out if I miss something here. I'm going to ask you. And then just to let you know, because it's an avenue for input into the state plan, we have a couple of other local folks on the state plan committee. One is David Lindeman, who's an expert in technology and aging and works at the University of California, Berkeley. And the other is someone who I think we've had here before, is Kevin Prindeville, who's the Director of Justice and Aging and one of the absolute best senior advocate folks that I can think of. So you can get to any of those folks. So let me just start by saying briefly that Oh, Janie, you're here. Thanks, Janie. I'm sorry. I apologize. We got more people, which is good, by the way. We love it when we have our folks. So let me just start by saying a couple of things. Number one is the executive order that Governor Newsom basically put out to start this master plan on aging process was a great thing for many of us. And here's why. We love Jerry Brown for a variety of reasons, but Jerry was not too interested in the aging issue. Some of us were suspicious that it was about a little bit of denial of his own aging, but nonetheless. Others, maybe it was budget reasons, whatever it was, he wasn't too interested in talking. Now we got this, young, glamorous governor, and he immediately recognizes this is really an important issue, and puts out an executive order saying we are going to create a plan for the state of California, a good thing, and one that really encouraged us. So that was the executive order. Let me just say, Marco could do this with his eyes closed, right? I can't. I got to look at some of the slides and such. So some of the idea of this was to build on some of the strengths we have in California, and I'll just mention those real briefly. We have a very comprehensive Medicaid program. We have home and community-based services, a big IHSS, home supportive services program. We spend 57% of our LTSS money on home and community-based services versus nursing home and institutional service. That's a very good percent. Nationally, it's about 45. So California is a pretty progressive system. I think there was a desire to use your feedback, and the state did a number of listening sessions to begin with, and not a surprise after we saw some of those word graphs up there earlier. Housing, aging in place, got a big percentage, healthcare, transportation, home and community-based services, all big shout-outs in terms of what we would concentrate on in the master plan. The state then put together a framework where they tried to think about, okay, what would be person-centered goals that would also eventually be a blueprint for local communities, and this is the tie-in back to the county, local communities to work on. So they'd be both state goals, but they'd also be friendly to local communities to be a part of. And really thinking a little bit about what would be the indicators that we would want to see in years to come to know that we had been successful in terms of improving aging care. So what are we doing? We're looking at past master plan events, and some people joke, oh yeah, we got master plans up the wazoo, they're all on the shelf gathering dust. So one of our challenges is to figure out how we do better than that this time, how we actually use a planning process. And by the way, in addition to the folks in this room, we got a great group of folks on this advisory committee that many of whom are real experts in the aging field. So one of the challenges there is to use those people, and then fight our way through, which you all will help us with, fight our way through the Department of Finance and some of the pressures to not really spend money to improve. But we're going to get there. So the areas that the state is divided to work up into are essentially these. The executive order says that long-term care has to have its own committee, and the governor wants a report back by March, so very quickly. The state says that research has to have its own work group. And then on top of that, the process has already developed groups in healthcare and healthy aging. You heard some of that this morning, so to work in that area, including integrating care across health and long-term services and supports. And then also the healthy aging side of that. And then secondly, a work group that will deal with economic security, poverty, safety issues related to those things. And then thirdly, a work group on healthy aging. Debbie, did I miss aging communities kind of projects like we talked about? Did I miss?
We had four subcategories. We had the LTSS and the research subcommittees, and there were 4 work groups.
Okay, so Well, yeah, we're missing one in there, right? So anyhow, that's the kind of work that's being done. The process is being rolled out fast. But I'm gonna try to channel Kevin Prindeville, unless you and us all get involved in pushing for some changes and improvements to happen at a policy level at the state. It won't happen. So we do need your involvement. There will be listening sessions. People like Wendy will be gathering feedback, but also you have up here basically the master plan website, and there is an email for you to put direct feedback into the process, and there's quite a bit of information on that website as well. So that's just a teaser for today, but it does indicate that the state is interested in moving in this arena, and at the same time, the state Medi-Cal program is doing a whole new redesign called Cal-AIM on Medi-Cal that includes duals, long-term services and supports, and other aging-related issues, as well as other populations. So quite an opportunity time to impact where the state of California is going to go with aging, and that we expect to come back down and interact with what we're doing at the local level. So I'm gonna stop on that, and let's ask, well, two things. One is, remember that fill out those cards with questions as people talk, so you can have those ready. And then secondly, let's just ask people when we're going to ask you to actually come up. I don't have my list of order. Nate first. Nate gets to be first. Great. As should be. Nate, come on up. We're going to ask you to speak from the podium. And Wendy over here is our timekeeper, so she'll be flashing you signs and signals as need be. Thanks, Nate. Let's give Nate Miley a hand.
So thanks. Okay. Well, thanks, everyone. It's good being here this afternoon. Or is it still morning? I think it's still morning. So this morning, it's been a while since I've been at Make a Difference Conference. I think last time I was here, I was on a panel with Supervisor Chan. Then I want to thank Wendy and her colleagues for putting together this discussion today and continuing to hold these Making a Difference conferences here in the city of Oakland and throughout the county. And thank all of you for your participation in the field of fighting for and helping older adults. You know, I've been working with older adults since 1986, so it's approaching nearly 40 years, and I think I've been working with Wendy now for about 20 years or thereabouts, and so it's been a long struggle, and it's good to see things like the governor wanting to put together a master plan on aging for the state, and the work that's being done locally in the county and the cities to create age-friendly communities. All that's progress. It's been a long journey, and we're still on the journey. You know, I don't see any light through the end of the tunnel, because I think the journey is constantly evolving, because once we get above the clouds and climb that mountain, there's another mountain to climb, and we just got to keep on working and pass that baton, and appreciate everything everyone here does, as well as all the organizations that are involved, et cetera, to push this agenda. The county, I chair the Social Services Committee for the county. I'm also the president of the United Seniors of Oakland and Alameda County. And, you know, the Board of Supervisors, we felt it was important that we look at developing a comprehensive approach to aging in Alameda County. For way too long, the county departments and agencies worked in silos, and, you know, Randy heads up our aging and adult and Medi-Cal department under the Social Services Agency. And it seemed like everything related to aging was in that bailiwick. But aging is more than just adult and aging. Aging, healthcare has a role to play. Public protection, for instance, the Sheriff's Department, the District Attorney's Office, they have a role to play. Clearly, our Housing Department has a role to play. So to have these departments with the best of intentions doing things in their silos just wasn't working. So I know that Supervisor Chan, chairing the Healthcare Committee, and me chairing the Social Service Committee, we came together and said we needed to develop a comprehensive approach to aging in Alameda County and stop having the county departments and agencies work in their silos. Because even within the healthcare agency, we've got healthcare, we've got behavioral health, we've got public health, environmental health, the officer of the agency administrator. That's our healthcare agency, and even within the agency, departments weren't necessarily working together. So it's just really important to create a seamless approach to working to ensure that older adult issues and concerns are being looked at holistically and comprehensively, effectively, and that we had a plan, we had a vision, staff were talking to one another and not working in their silos, and not just working with the best of intentions, but also being as effective as possible. There should be no wrong door for older adult services, and there shouldn't be a lack of our ability to move an agenda for older adults. For way too long, we talked about the aging tsunami, but we weren't really doing anything, and I thought it was important that the county move in a direction to really demonstrate that we're going to embrace this and we're going to try to do something about it, and if and at all possible, try to get ahead of it. I don't think we're ahead of it, but I think we're catching up. We're catching up because there's a lot of folks out there who are homeless today who are older adults, and that's a crying shame. So that's one example of, I'm not trying to disparage the county or the jurisdictions, but that's one example of, we haven't caught up, and we need to catch up so that we're ahead of the agenda as opposed to being reactive. The slides up here, my staff put together some very simple slides. Not because I'm simple-minded, but they felt that I didn't need to have a lot of slides with a lot of talking points since I've been involved with this for nearly 40 years, and it's really a passion of mine. Because I've often said, and the United Seniors, they know, and many of you have heard me say that if it's good for older adults, it's good for everyone. If it's good for seniors, it's good for everyone. And so whatever we're doing is good for everyone, because if those of you who are not seniors, and I know my daughter's in the room, she works with seniors, but those of you who aren't seniors, if you're fortunate enough to live to become a senior, you want to have a good quality of life. You want to be able to age gracefully. You want to be able to age successfully. You want to be able to age with dignity. And we can't have those just be words and rhetoric. We need to achieve those through a master plan for aging in the state, age-friendly communities at the local level, and then all of that combined to make a difference, because the older adult population is growing all over this country and all over this world. And how we treat, it's often how we treat animals is how we see our society. Well, I'd like to say I have no problem with animals. I have no problem with young adults and youngsters and youth, because I've got a couple of grandkids, and I've lived long enough to become a senior. But I say how we treat older adults indicates our dignity of our society and how we see ourselves advancing as a people and as humanity. So thank you, Wendy, for putting this together again. Thanks for allowing me to be here. I'll answer questions you have at the appropriate time.
Okay, good morning, everyone. I'm very happy to be here with all the advocates, and I want to congratulate the cities who are starting to do great work on seniors. We're very proud of you. I would just say the most important thing really is to flip the switch on the view of seniors. I often say when I'm at these conferences, I'm from a culture that values seniors, and it makes a really big difference. This is a culture that doesn't value seniors at all, and we have to flip the switch on that. This is also, I would say, a moment of opportunity in terms of our advocacy. You heard a little bit about the plans that are taking place in the state, but I will say without regret, the state has not done a good job on senior issues. I was in the legislature before, and it's been years and years, and there's been plans and plans and plans sitting on the shelves. And I know I sat on the senior committee my first year in the assembly, and it was a committee that actually wasn't well populated, and a lot of times members didn't even go because they didn't see the importance of it. So we have a governor now that started a plan, and this is a moment of opportunity. They don't often come, so we have to be very loud this year and really insist that something happened this time and that the plans don't sit on the shelf. For myself, I came to this, I've been involved in these issues for a very long time, but it really struck home for me when my dad, who was 93, who was very healthy throughout his life, but he got cancer when he was 93, and I had to navigate the system for him. And as some of you know, I've been in healthcare for like 30 years, but even for me, as someone who knew the system, I had a really, really hard time. I didn't know very much about hospice care. I didn't know which provider to pick, and then when they were in place, I didn't really know what my rights were and how to utilize it, and it was very, very difficult. And of course, you're trying to deal with a family member who's dying and very sick. There were things like, well, he could have radiation, but you'd have to bring him every day and wait because there's no appointment times. You just sit there until it's his turn. You know, it's kind of like going to x-rays or something like this. And that's the choice. You can do that, but that's probably not a very good choice. So I really became very involved in, we didn't talk about this, but the whole thing about advanced care planning. It's not a topic that people really like to discuss. Particularly in my community, people don't like to discuss it. But I do want to just make a pitch for, we do a lot of senior workshops, my office, throughout the county. And I think it's really important to do advanced care planning. I know for myself, I've already done it so that my children will know what to do when the time comes, and that my wishes are upheld at the time things happen. Because if I leave it open, you know, it's going to be very hard for them to decide. It's very, very difficult. So I want them to know and be assured that they're doing the right thing for me. So we're going to continue to do these workshops. They're very, very well attended. So if you want a workshop in one of your communities, you should let us know. We go over all kinds of issues, legal issues and medical issues and wills and other things like that that you need to attend to, because we're all going to die, let's face it. Okay, so so I think it's very important. The other thing is I'm working on is at the county with Nate is we really do want a single point of access. We talked about that a lot, and that also stems from my experience. Like I said, because it's very hard to navigate the system. When you have to call like 5 or 6 different places and be put on hold, and it's terrible. And it takes your whole day maybe to get one thing done. And then one of the earlier speakers said that people don't even know what services are available to them at this point. And they may be missing out on something that's actually a covered benefit for them. So let's really do that, and you know, other speakers have spoken to that already. And we want to launch this. I think Randy's going to talk about this, but we want to launch this portal by the end of the year so people have a much easier time navigating the system. I want to talk a little bit about housing affordability, because many of you voted for Measure A1 a couple years ago, and we really have been able to build quite a few units. 322 senior units are in the pipeline with A1 funding. And previously, when redevelopment existed, we had 714 units in 14 projects from sources other than A1. And I had the joy, there's a project in San Lorenzo, which is part of my district, and we opened a senior housing project there about 1.5 years ago, and I literally experienced the joy of seeing someone move in there. It's a beautiful, beautiful 1-bedroom apartment, and unfortunately they were on a waiting list of about, I don't know, it was lottery, and you know, there were like thousands and thousands of people on this list, and this woman was just so happy to get into this housing, and I saw how she had set up the room, and it was just wonderful. So we have to do more of this and push for more state funding for senior housing. We also, in A1, we talked about being able to stay in your homes, and I want you to be aware of a program we have at the county that's part of A1 that you can apply for now, which is loans to fix your home so that you can stay in it, because a lot of people end up having to move because something happens to their house, like their hot water heater breaks, or the roof is leaking, or the sidewalk is cracked, or you know, something like this that actually could cost us quite a bit of money. And so we do have a program now for that helps cover that. So if you want to know more about it, we can give you information on that. And the last thing, I have a minute, is food security. I've done a lot of work on food security. We have a lot of hungry seniors in Alameda County and children, most vulnerable population, which is really a crime. And we're going to continue to work on that. I just want, in my last few seconds here, to tell you that we started a food recovery program recently. I purchased 2 refrigerated trucks. A couple years ago, we had them fitted, and we just got the program going, so I'm very excited about this, and I hope you can help. This is something like outside of the box. In the first 2 weeks of the program, we collected 6,000 pounds of unused food from 2 school districts that overorder their food, and it was meat, cheese, and frozen vegetables primarily. And we were able to deliver it to 367 people in mainly seniors and satellite housing projects. And there is so much food here in Alameda County that isn't used. And now we have the means to distribute it and keep it fresh while we're doing that. So that's just kind of a new program that we're doing. So I look forward to answering your questions and working with all of you. Like I said, this is the time. So let's seize the time. Thank you.
Excellent and practical. Love it. Randy Morris.
Thank you, Marty, and our excellent elected officials. I'm proud to work with you and for you. Randy Morris, I work in the Alameda County Social Service Agency. For those of you who don't know, we're a very large and complicated system. We have 3 operating departments, and I'm the director of one. The other 2 is the Child Welfare Department, and then the Workforce and Benefits Administration, which manages the public assistance programs like CalFresh and Medi-Cal and CalWorks. And I have the adult and aging programs, which include some programs you might have heard of, like in-home supportive services, adult protective services, public guardian, veteran services. But the one I'm going to talk about most, because it relates to this conversation, is the Area Agency on Aging. An act of Congress in the 1960s created something called the Older Americans Act. It often gets eclipsed because at the same time Medicare and Medicaid were passed. But the Older Americans Act mandates that every jurisdiction throughout the United States of America have an area agency on aging, and I think to provoke the point, which I'll talk about, and to develop a plan for seniors. Yet there are multiple jurisdictions coming out, despite we already have a mandate to develop a plan for seniors, to have a plan for seniors. So a lot of the work today is how do we do both of these together so they don't bump into each other, but they're aligned. This forward or back? Okay. So to start, I just want to say a couple compelling data points to ground this conversation. There's a lot of data. We could have took hundreds of points to make a statement, but I think 3 I wanted to highlight. It's complicated to balance the keynote speaker's presentation about opportunity versus challenge, and I just want to name this as a narrow view on the issue of the data. But for those of us who work in the safety net, who deal every day with the system being fragmented, as has been described, not well coordinated, there are multiple doors, they're not coordinated, and there's not enough resources. It's important to name a couple data points that how are we going to deal with a system that doesn't have enough resources today when the numbers are. So under the issue of the aging boom, when you look in Alameda County from 2002, we're projecting to 2020, the 65 plus population has doubled. It was 130,000 in 2000, and it's projected to be 260,000 next year. So it's doubled in a very short window of time. And looking forward, when you look a little bit before now and you look forward to 2060, it's a horizon issue, it's projected to triple from where we are today. So that's like, how do you get your head wrapped around that? To the issue of safety net, I want to thank our healthcare partners who have some amazing data, and I think this tells a big story. I think we have our some EMS staff here. When you look at I saw that, yes, okay, EMS, go EMS. But this is a pretty big data point just to think about this. In 2018, the data they shared with us is approximately 50% of all 911 calls in all of Alameda County were older adults. So the safety net is feeling the impact, and that's before you get to the data. And then the last, and I admit this is intentionally provocative, but how can you talk about age-friendly when we're dealing with a state that's on fire and dealing with disasters? So if you highlight what happened in the Camp Fire, before you get to the North Bay fires before, and the Camp Fires up in Paradise, 85 people died. 75 of them, or 88%, were older adults. So how do we get square being age-friendly when our disaster plans and what is happening in front of us is as compelling as that data? So now I'm going to speak a little bit about basically the arc of what Supervisor Miley started very humbly, Supervisor Miley. I was waiting you were going to say this. So what actually happened in 2014, I am a direct report to my director, Lori Cox, and the way our budget hearings work in Alameda County is the healthcare goes first, the social services go second, and Supervisor Miley, I can't believe you said that, but I'm going to give you this credit. This is what happened. Two super articulate, passionate, compelling directors gave their presentations, and then Supervisor Miley said to the healthcare director, "And what are you doing about aging?" And uncharacteristic of the healthcare director, he fumbled and bumbled through an answer to the question that didn't satisfy our board. And then my director went forward, who is equally passionate to the same question, and she equally fumbled and bumbled, and our board was not too happy, and we got a directive to get our act together. Does that sound about right, Supervisor? Yeah, something like that. So anyhow, it was very impressive, and I think it was our moment. So the short version of the arc that has happened since then, and this is where the AAA comes in. The Area Agency on Aging was just getting ready to do what the mandate from the feds to the California Department of Aging that drops in Alameda County, the AAA's in my department. We had to gear up to develop a plan, and we'd been doing it and doing it and doing it, but it wasn't very comprehensive. It was narrowly focused on sort of a set of funding opportunities we have for meals and some legal assistance, not to minimize those, but it was not comprehensive. So we got the mandate. We had a lot of public discussion at both committees to work together to align the AAA planning process with a much larger group of stakeholders, which included healthcare, CBOs, of course Wendy Peterson, because she's in everything aging, and we worked together to develop our plan, which was put in place back in fiscal year 16-17. The plan basically identified a few priorities. Number one, to codify what had become this very comprehensive committee of stakeholders and make it a permanent fixture in the way we do business here, to have this big group always looking at planning, to apply to become age-friendly, and so that became one of our priorities, and then a whole host of issues, including housing and elder justice and other things. We formed the Age-Friendly Council, it is called. We work very closely with the AAA's Aging Commission, which still exists, and we applied to become an age-friendly in March of 19. We were awarded. Where's Rafi? Thank you for the support. And we are in the process of doing our AAA planning process today in alignment with how do we get our heads wrapped around doing these two things at the same time. Efforts to date with the card that I'm almost done. I'm just going to not go through these, but Supervisor Chan mentioned we've had a number of committee hearings at the board, and one of them was please create a website where you can kind of have a better way to look at all the services. So it might not be that there's no wrong doors, but at least there's one website to look at everything. That's scheduled to launch in January of this year. We have agreed, and this was talked earlier today, about the lack of a training curriculum that's very comprehensive. We're fortunate with UCSF, with a HRSA grant and local commit to get a trainer to develop an Embracing Aging training curriculum that will launch in the months ahead. We have done a tremendous amount of work in the fields of elder justice, housing, and legislation, but I don't have time to go through those. We can cover them in question and answer, but I think Supervisor Chan mentioned housing. We've put a whole committee together and brought forward some recommendations specific to older adult needs. And then I want to end with sort of some of these next steps where we are today. I'm going to kind of summarize four of them very quickly. One is we want to make sure that the current AAA planning process we're in the middle of, which has resulted in over 6,000 survey results from out the community, dozens and dozens and dozens of community forums. We specifically organized our community forums to be in unincorporated areas, which the county is responsible for, and organized the forums around the age-friendly domains so that the work was aligned. We want to strengthen our city partnership. There are some counties around us, Santa Clara and Marin, that have worked to try to work together with cities. We don't have any oversight of them, but we want to make sure these efforts are aligned, both the ones that presented earlier and to encourage new ones. We have to focus on unincorporated. Cities don't have any authority, so we want to develop our age-friendly efforts with a big highlight on unincorporated areas. And then I think the last, before going to my final slide, is we do need to engage more government agencies. Our work is safety net service providers, health, social services, housing, but there's untapped need to work with Public Works and Library and General Service Agency, who's doing lots of things around older adults, but we need to coordinate it and be better working together, and that's some next steps. And then the last, I will say, mindful the state is doing a master plan on aging, and we have a lot of commitment here in the county. There are very few things we have complete control over in a county jurisdiction. We're so dependent on federal and state funding and budgets and regulations, but the one thing we have total control over is whether or not we work together as a team or we sit around and point fingers at fight. And I do want to say it's my honor to be part of this team that's up here. This was at the Board of Supervisors. They recognized us June 4th. We had Rafi come out who gave us an award and we gave him an award, and it was a kumbaya, let's do this. And we actually had a number of events that day celebrating Older Americans Act Month, CalFresh Awareness Month with the SSI cash out that there's not now a lot of older adults eligible, Elder Abuse Awareness Month in June, and then we had this big discussion. And so we have a great team. I think we have to concurrently keep working locally and really lift our voice up in the Master Plan on Aging, and that's what's ahead. Thank you.
Thank you, Randy. We're lucky to have you leading the staff effort. Thank you. Michelle Bird, on the public health side. Michelle.
So this is Angela. I'm not her. That's Angela Ball, the director of nursing. So I'm stepping in for her today because she got waylaid by a bad cough and cold. Oops. So, okay. What I'm going to talk today about is about the intersection between public health and age-friendly. I'm at the Alameda County Public Health Department. And just to talk a little bit about why there's a lot of overlap and good fit. The health department the mission of the health department is to eliminate health disparities and work towards achieving health equity. And we do this by addressing social determinants of health. And Wendy mentioned what some of those things are, but they're the conditions in which we, live, work, age. And they're largely determined by the distribution of money, resources, and power. So that's the work of the public health department, and there's a lot of overlap, as you can see, with the 8 age-friendly domains. And so it's kind of a natural fit, a lot about physical environment, health services, economic justice, and with the health department, this is all through a lens of racial justice. So I think it's a nice fit, and it really helps us in the department think about our work with an aging framework and lens too. So, and then also with the health department, we conventionally have seen focused on the most disadvantaged, the most vulnerable of our residents, and so that's in the safety net. And just to note that that's a lot of people, because increasingly we're dealing with a lot of senior poverty, and we've touched on that today. But 1 in 4 Alameda County older adults lives at 200% of the federal poverty or below. And so what used to be, I thought of as more of a marginalized population, is looking less marginal and more mainstream. And I think we really have to think about that in our age-friendly planning, especially if we want to, if we want to be able to maintain Louise's curves of happiness and anxiety. So let's see here. Next one. Yeah, so we work with folks with a lot of competing priorities, financial liabilities, and so people are increasingly pressured to the competing demands of unaffordable rents, medical cost sharing, prescription drugs, transportation, and especially caregiving, which are so expensive in general, but especially in the Bay Area. And I also want to highlight that so many of our elders are socially isolated, and social isolation, as Louise mentioned, really leads to some very poor health outcomes. Not just physical, but also mental and emotional health. So, and I also social isolation is such a huge topic for me too, because it also really, really reduces people's caregiving options. When people are disconnected from family and friends, they're also struggling with housing costs. This can really snowball and cause a lot of what could be minor issues to really become crises. And it also can lead to more people becoming without the proper housing and without the proper caregiving. What ends up being a default is more and more people prematurely ending up in nursing facilities. And I really need to think about that again in our age-friendly planning. In Alameda County Public, I just kind of skated over that, but our public health nursing programs, I think the public health nurses are uniquely qualified to do this kind of work, just because you can't disconnect the medical complexity of a lot of our especially most vulnerable older adults from the psychosocial context in which they live and that are creating huge barriers. And I think the public health nurses are trained to understand the medical complexities. They also have learned and know and are trained to work and navigate those complicated healthcare, the complicated healthcare system that Supervisor Chan mentioned. And we also understand the psychosocial context, the social determinants part of it, and the community resources that exist to serve our clients and our patients. We have a small home visiting case management program that I and my two lovely colleagues here, Sonal and Eileen, work in, and that's for very fragile, very medically complicated, at-risk clients. And then we also have, in a collaboration with social services, public health nurses embedded in IHSS and APS to see those also medically complicated clients in social services. In terms of where I see expansion of the work or thinking about building our age-friendly is, I'm just going to list a few things. Housing as medicine. We have to think about housing as medicine. Also, caregiving affordable, competent caregiving has got to be a part of the picture. This is a huge problem for our most vulnerable, and also our folks who are kind of caught in the middle and don't have Medi-Cal and so can't access IHSS. Also, I want to talk about prevention. You know, the public health is traditionally prevention-oriented, primary upstream, but we see so many people, I think, in the healthcare world or in the world don't see risk until it is people have very advanced problems, very advanced health conditions, and things that have sort of unraveled out of control. So really thinking about prevention and identifying risk. Another thing is multidisciplinary teams. This is extremely important in complex care so that we're really able to navigate, communicate, collaborate, and coordinate care, and we have a joint understanding. And central to those multidisciplinary teams, I think caregivers need to be part of that conversation, a very large voice. And then also coordinated care so that we're able to coordinate, think about the medical care and sort of medical and social comorbidities so that we're dealing with them together and that we're able to provide better coordinated medical and long-term services and support care. So those are some ideas, and I made it. Thank you.
Thank you, Michelle. Thank you for bringing some of the words about team-based care and coordination that those of us in the health arena find so important. Thank you. Okay, so questions on written cards, and then we'll start up here, and if you get the questions to our volunteers, who will get them to Wendy, I think. Let me just start in our discussion by saying, Debbie, or maybe Debbie and Johnny, slip me a card just to remind people of the person-centered goals. This is my marker roll. The person-centered goals in the Master Plan on Aging, and they are these. We will be able to live where we choose, and that includes long-term services, home and community-based services, caregiver supports, etc. Goal 2, We will live in and be engaged in age-friendly communities, and that includes housing, transportation, mobility, ageism, isolation issues, civic engagement issues. Goal 3, we will maintain health and well-being as we age, include some of the health and oral health and behavioral health issues, as well as healthy aging. And goal 4, we will have economic security and be safe from abuse, neglect, and exploitation. And that's obvious, I think, but that also includes some of the disaster issues we've been talking about up here. So those are some of the stated person-centered goals in this state plan. Now, while Wendy's collecting questions, let's ask, Wilma and Nate, let's ask the two of you first on this. Is there, if you had to ask one or say one priority in Alameda County that would have the most bang in terms of making either a policy change or a programmatic change in Alameda County, what might it be? What might come to the top of your head? In this area, of course, yeah.
Solomon.
Well, you know, someone said earlier that we're somewhat limited by resources. I guess the most important thing we can do is the thing we're going to do is to put all our resources in one place so you can get them. But I will say I'm really pushing for people to really ask for bold things from the state right now. Some of the things I really would like to see is one is like universal IHSS. The income guidelines are so low that people who are just slightly above, I mean, it's very low, right? But everyone needs this. Everyone needs this, and people can't pay $25 an hour for this type of care. And then the other one would be, it would be great if we could stop the cliffs that these different programs have, like SSI. If you're $1 over the cliff, you have to pay the whole thing. So why can't they do it gradually like other programs? If you're a dollar over, then maybe you pay $1 less or whatever like these. I think those two changes would really help seniors in California a lot, and I would be happy to advocate with them, with you for them.
Well, the one thing I would probably see would be having the county have like a older adult czar. We just recently in the Healthcare Services Agency, the agency directors has hired a staff person who's going to head up our homeless efforts, and she'll have a staff working with her, and then all of those folks will be working with all of the other county entities that are involved in the homeless effort. So, but there's one point of contact, that person, as I see it at this point. So I think something like that would be good, and I'd probably put that person in the county administrator's office, because that would also indicate the importance of this. And it's not to say folks aren't coming together and working, but I still think in terms of accountability, coordination, efficiency, it would be good to have one person at the top who the public knows and the Board of Supervisors we know who can be held accountable to ensuring that everything is working as efficiently and appropriately as possible.
Great. Thanks, you guys. That's good. Okay, one more for Wilma and Nate before we go down the table to Randy and Michelle. Somebody, and we're doing audience questions. I'm moving to audience questions. We may get back to some of these others on our list. Wilma and Nate, would you be willing to introduce a resolution requiring all county agencies to explicitly address older adults in their policy and planning?
Yeah, definitely. We didn't do that already? I don't think so.
Maybe they did it already.
We've done father-friendly resolutions because some of our social services only really saw mainly women clients, so they didn't necessarily deal with men. Yeah, I think that's totally acceptable.
Definitely, and the county has a Vision 2026, and all of our, that's been adopted by the Board of Supervisors. Many of our county agencies and departments are aligning their strategic plans with the overall county vision for 2026. And I think within the Vision 26, there's a segment of it that speaks to older adults. But if it doesn't, then yeah, we should definitely integrate it into the Vision 2026 so that when a board letter comes to the Board of Supervisors from any of our county agencies or departments, it could speak to what they're doing in reference to addressing or helping to support older adults.
Thank you. You know, speaking of some of this cross-department work, I was so impressed with Suzanne's comments about street lighting and coming from a community that's had a lot of pedestrian injuries and fatalities. That was just a real simple example, you know, when other departments start working on this stuff. So, okay. Randy, this one's for you. It might be a hard one. Biggest challenge as a case manager working with seniors is the absence of available IHSS workers. How do we address that?
In 30 seconds.
Hey, you can have a minute.
Well, I have to read in between the line, lack of available. So for those who don't know, the IHSS program can be argued came out of our backyard, out of the Berkeley independence movement. Right. And it's very important, I think, as a table talking about aging, that it really came out of the disability movement, not the aging movement. And the reason I say this is because when I promoted 8 years ago, I didn't even know what the acronym IHSS meant, so I was a new set of eyes. And one thing that just struck me is you have to serve age, blind, and disabled on a policy platform based on the Berkeley independence movement, where it's somebody who's disabled who gets to say, I pick who touches me, and is fully empowered in selecting who their provider is. But increasingly, 4 or 5 decades later, the program's built on those principles and doesn't have good policy around what do you do if the person lacks capacity, if they're having a complicated time in managing a provider, et cetera, et cetera. So there's this thing called the Public Authority Registry, and that registry works very hard to attract people to be available for someone who can't hire their own person. And then I would say, thanks to our Board of Supervisors, sincerely, we have been close to, if not the highest paying county, because that's a collective bargaining action and a decision by our board. But to Supervisor Chan's point, it is still half of market rate. So I think there's a real conundrum there. I don't want to punt, but I want to say I think there is in this master plan discussion, how do you deal with the fact that counties get put pressure on them? And I don't want to speak for the board, but I think it is a conundrum. You probably want to make a $25 rate, but if you did that, you would bankrupt the county. So trying to figure out a way, I think, would be better solved by a discussion at the state to make the funding more able to make the way in which providers are paid more market rate. And then at the local level, it would be a lot easier for providers to answer that question. So I think we're kind of in a quandary, and I think the master plan is a good forum to fix the county conundrum.
So the importance of working with state policy as well.
Yes, be bold, as our elected officials said. there are solutions, but it's going to take some action.
Yeah, I like that you pointed out different preferences amongst different populations in our aging and disability service population. Some folks want to control, other folks would really like somebody to integrate and have a coordinated care approach for them. So I think a real important distinction, as well as the capacity issue. Michelle, you're right to be waiting down there. This one's for you. Sounds like public health nursing has a small home visiting program for medically fragile elders. How much more expansion would be necessary to meet the actual need? That's sort of in the same realm.
It's a huge need, and because our patients are so complicated, and I'm not just talking medically, I don't think actually, to be really honest, it's a great framework that we're using. My team has thought a lot about this, and what we think would be a lot more functional of a structure was to have really well-trained, paid caregivers who were part of the multidisciplinary team, who were able and competent to be able to identify when there's a problem, know who to call in the team, people that they talk to frequently, and get in there and intervene before there's really an emergency. So to me, it's based on caregiving. Really, they're the people who are there every day, and then our reach would be so much, and there would be public health nurses, there would be social workers, might be a geriatrician to consult with, but really the bedrock of I think a very functional program for the most medically fragile elders and most isolated is to have a really solid framework, bedrock of caregiving, and build on that.
Okay,
And it would be cheaper too, a lot cheaper.
Thank you. An extension of that, by the way, is I'll comment from my over 60 health center experience. We've started to think that almost like the homeless population, the best place to serve people with severe and serious needs and complex needs is where they are. So for some people, that means getting them primary care in their home as well and having a house calls program. Of course, Louise, who spoke earlier, has been a house calls doc for many, many years. So another side of that I think will grow into as the population ages.
And Marty, also because we have a history together of adult day health care, and so social model programs like that bring people together and address their medical concerns. They have regular contact with trained staff, and they have the socialization and engagement and joy in life. These kinds of programs are really critical, and they were defunded pretty much or reduced.
Hold on, did you write this question?
Anyway, that's it. But ADHD.
Well, so I'm going to read this question/statement, and you may want to say more, or we'll just let it stand as a statement. Can you discuss how the reduction of ADHDs by the state, interaction with state policy, directly impacted quality of life, socialization, and health for so many vulnerable adults? As I said, it can be a statement, but if anybody wants to comment beyond what Michelle just did, Wilma, you look like you're ready.
Well, I don't know on the ground that much, but that was a horrible decision. I worked with Wendy and a lot of other people. That was in, 2011, 12? Yeah. That was a cut that I don't think ended up saving money. I bet if they did an analysis, and so many people, centers closed, some of the, I think one of the only centers for dementia closed, and then the process finally, because the coalition was so active in the state, some of the program was restored, but people really had to go through a horrible process of being interviewed like 2 or 3 times. They didn't have interviews in the person's language, and they were almost like on trial to get back on this program. And not only was it harmful to the recipient, but harmful to the caregivers who had respite when their family was able to go to the program. So I think we should look at what the result of that was, and that should be another platform in the programming that comes forward.
Great. Okay, thank you. As stated, most of the funding for senior services comes from the Older Americans Act. Are there any conversations in the county to find ways to increase local funding that can fund programs beyond what Older Americans Act covers? And maybe, Michelle, you might be able to get off that one, but Wilma, Nate, and Randy, comments on that?
Well, we did add some funding. So we did add some funding within our limited budget, and I think we're always looking, Nate and I are always looking at ways that we can increase funding, or we can put programs together that would save money. That's another thing we should look at the state. If there are programs that if they were, the funding was blended, or there was more flexibility in terms of funding, that it could actually save money. But we do have limits because 60% of our money comes from the state and federal government. So even though our budget looks really big, a lot of it isn't discretionary, but we have added some dollars.
Yeah, I would co-sign that, because most of the funding is categorical. That's the important reason why we need to have our agencies and departments not working in silos, and see how they can work collaboratively and maximize those resources holistically to serve the older adult population. Additionally, we have Measure A, which is the essential health care measure that passed a number of years ago. I championed that, and we provide funding for older adult services out of Measure A. I know, we've provided funding for Meals on Wheels, et cetera. And as Supervisor Chan pointed out, we're always looking for new ways of coming up with funding. The state really needs to reform our revenue approaches. because constantly going to the ballot box to ask the local electorate to pay more taxes, whether it's sales tax, this, that, or the other, to fund services, I think is a, at some point, voters are going to have fatigue. And we're going to be doing it, we're putting another measure out there soon on homelessness. And we've talked about putting a measure out for older adults. And I know when I was on the city council in Oakland, I did such a measure, and it failed by about 160 votes to get the 2/3 in the city of Oakland. This was back in the 90s. So I just have hesitancy to always want to go to the electorate to pass yet another ballot measure. But that's always something that can be contemplated. But we really need to have reform at the state level.
And I just want to add, to be a little more specific and to give some kudos to the board and to the partnership with healthcare. So we have about $6 million of federal and state AAA money, and Supervisor Miley, perhaps that "what are you doing about older adults" to my boss Lori turned around very quickly into she added $1 million of general fund with board approval and county administrator approval, which is significant, from 6 million to 7. The shout out to healthcare, because healthcare's leadership in partnership with us administers the Measure A money, which ultimately requires a board vote. And because there was new revenue, healthcare advanced forward in partnership with us to ask for $1.5 million new dollars to help older adults, and half of that, $750,000, was specifically shifted to supplement the AAA. Now, to those in the room who deliver service, it's still not enough. But I think I just want to say there have been some very real efforts with very real money landing to answer the question.
Great. I'd sneak in a couple of comments, which is simply that Nate's work on the measure in Oakland, although we didn't win it in the 90s, I thought advanced the whole understanding and discussion about the needs for an approach to elder services and elder care in the city. So you got some plaudits for that, even though we were a few hundred votes short. Then the second thing that I would say to people is simply a reminder that Older Americans Act monies and county monies can only be a small piece. If you look at the amount of money that's spent on Medicare and Medi-Cal, Medicare nationally, Medi-Cal in the state of California, those dollars dwarf what the county can spend. So one issue is to make sure that you as advocates are trying to influence what happens in those two spheres, the Medicare and the Medi-Cal arenas.
Can I add one thing?
Yeah, please.
Yeah, the other thing is to look for more private and philanthropic dollars, because I've done a lot of work with philanthropy, and they don't tend to fund senior programs. And it's such a big need. I mean, they fund certain programs, but I think if we do a great advocacy job this year and put together a good program, we should try to push it, because there's a big need there. And then also in terms of private dollars, Kaiser, just finished a program to house seniors, and they put in $3.8 million last year, and were able to house about 600 seniors, a lot of them in private homes. And they're going to go out again to their board in December around that funding. And the business community, not just the healthcare community, should see the need in the city, just even if they're not compassionate, just from an economic and social point of view, to put in that funding.
Excellent point. Okay, here's a very specific one for Wilma, but maybe Randy can help too. A1 loan funds. Is there an income limit to fix up your home? Does either one of you know?
The general programs go up to 150% of the federal the poverty level. So that's about, like, it's pretty high. That's like $90,000 for a family. But we really put the emphasis on these loans at the 20% level, which is, much lower. It's about, I think it's about 20,000 or something like this, somewhere in that range, 18 to 20,000. So I have staff here, or you can see me afterwards if you're interested in getting this information. This is really a good program because it's interest-free, and you don't really, the payback is over a very long period of time, I think, when you sell the property.
Great.
You called me out, Marty. I don't have a specific answer, but I want to underline something that I think is going to resonate with this audience, and it's something Supervisor Chan mentioned earlier. The safety net programs are generally funded by means testing, and there is a growing crisis in this country, actually, which is it's no longer the haves and the have-nots. The have-nots have actually, to lack of a better word, have access to the safety net services, Medicaid. The haves you can break up into the 1% and the middle class, but you have this new issue which is just above the federal poverty level that increasingly cannot function. They do not have the resources to survive self-sufficiently, and they are ineligible for the means-tested programs. So the size of that, often referred to as the near poor, to me is a major discussion in the master plan on aging, because if we only focus on growing what we have, we're going to miss the fact that more and more people are falling from middle class into, and then they have to finally default or it's too late. So I just think that's a major policy discussion.
Yep. Yeah, lower income people obviously can take advantage of some of the publicly funded programs both at the state and the county level. But obviously, we're trying to come up with a master plan that speaks to all older people, including low income. So, okay, might be the last one. Let's see here. Michelle, why don't you start on this? The specific question is this, but I'm going to take it somewhere else. Alameda County does not fund supported nursing facilities that accept those with mental illness. Why not? But what I wanted you to talk about, you can say anything you want about that, but would you also say a little bit about integrated behavioral health and health care for older people and the importance of that, and then others chime in, please, on either the nursing home issue or the general issue.
Well, nursing facilities that take Medi-Cal at all for custodial care are few and far between. And, that's a problem just from the get-go. And then in terms of, we aren't touching on it now, but it's one of the breakout sessions in terms of even training and competencies, geriatric competencies, behavioral health competencies. I think those are lacking in a lot of the facilities, in a lot of our workforce in general. So I think that I don't know enough about nursing facilities because I've never really worked in any, but from what I see, it's that they're understaffed, their staff is not very well trained to deal with some of these, from some of the more difficult, challenging behavioral health issues. Also, I think that they're really not set up for dementia-friendly care, and that's kind of a thing that I didn't mention, but it was on my list of the Healthy Brain Initiative that the Public Health Department is going to be working on and trying to, and the Age-Friendly Council has already started working on, and we hope to partner with around following a roadmap developed by CDC and the Alzheimer's Association to build a more dementia-capable system. And I think that nursing facilities really will have to be pulled into that because I think their competencies around dealing with dementia behaviors and mental health behavior, behavioral health disturbances, it's probably not the right terminology, behavioral health challenges is really, really limited. And it's probably, as a result, a lot more costly. And I would imagine that is one of the main limiting factors. In terms of integrated care, that is seriously lacking. That was another thing on my list of being able to have, we talked about, there's sort of no wrong door and being able to come to one place where, we have elders who can't be, what we deal with a lot is people who have treatment plans that are really unrealistic given their psychosocial situation and lack of support. So getting to an appointment and following up is so extremely difficult, and people have complicated problems. They may have 6 different specialists. So how do we reduce that and make sure people are getting as much care, quality care in fewer and more integrated settings?
Great, thank you. Anybody? Well, let's just leave.
Well,
has a comment.
I always have a comment. Sorry. I want to toot Nate's horn because he spent the last 2 years looking at nursing home regulation and reform. So that's another one you guys should put on the list there. Because I just read this morning in the paper, did you see it, that one of the nursing homes in the fire area just left?
Yeah.
Everyone there?
Okay.
Left everyone there.
Yeah.
And this happens all over the state. And we can't place our seniors in places that aren't regulated and inspected on a regular basis. And Supervisor Miley did a lot of work. There are many, many types, but they're all very seriously lacking. So add that to the agenda.
Great, thank you. Well, we are at the end of our time. Oh, Nate wants to, Nate, you got the last word, man.
Yeah, thanks. I just want to conclude by saying, keep in mind, I know I'm preaching to the choir, that just to emphasize what Supervisor Chan was saying, we need all of you to be engaged. Often, you know, folks will be engaged when it comes to youth. But when it comes to older adults, they aren't engaged. They aren't showing up. We need you to show up. We need you to fight. We need you to be unapologetic, because the issues of older adults are extremely important. It's got to go from cradle to grave, and we need folks to be engaged. So please be engaged. We've got the 2020 census, they're hard to count. We're going to make sure all the seniors get counted wherever they are, whether they're in the homeless camps, whatever. We need all seniors to be counted, as well as all other hard to count populations. So I just want to emphasize that before we conclude our panel this afternoon. So thank you.
Great last words. Let's give our panelists a hand. Thanks, you guys. Great job.